Leg pain is fairly common and often the cause obvious, a pulled muscle or a sprain, but sometimes that pain has to do with a different part of the body. For example, a herniated disc in part of the spine caused by lifting weights. Mercy Medical Center's Dr. Justin Park says it's common for back problems to present as leg pain. Dr. Park says the first line of treatment is medication and physical therapy, but if that doesn't help, surgery is always an option. And Dr. Park is joining us here with more information. Good morning.
Good morning. How are you doing?
Thanks for coming in. So let's talk about this leg pain. I mean, when do you know it's something more serious than just a pulled muscle?
Sure. So when you have leg pain and it's persistent and it's not seemingly going away, and you feel kind of traveling down the back of your leg, it can also oftentimes be associated with more serious problems that have to do with spine pathology. So I brought here this morning to you a model of the spine. The lower back is comprised of 6 bones, and in between those bones sit these discs.
Hold that up just a little higher. There we go.
And oftentimes, in younger folks who are active, you can have a disc herniation that can protrude backwards and pinch one of the nerves that go down into your leg. In some of the more older geriatric patients, you may have chronic degenerative changes when bone spurring that develops that can also do the same phenomenon of pinching a nerve in the back that can cause leg pain.
And what causes this pinched nerve?
Well, it's
lifting weights? I mean,
so in the younger population, I see it oftentimes with lifting weights and acute injury. Some people who are laborers. In the older population, it may just be simply routine activities, just walking and standing, where they seemingly have reproducible leg pain.
And so surgery may be necessary. I mean, you actually go into the spine and work on the back there?
Right. So we always try to treat these problems with non-operative modalities, things like physical therapy, anti-inflammatories, epidural injections. But in cases where that doesn't alleviate the symptoms, then we do have to do a surgery.
Okay. Well, no, obviously not all leg pain is associated with the spine, right? I mean,
absolutely.
What other things are you seeing?
So other things that can cause leg pain are just activity-related, exertional leg pain. People who may have some poor blood circulation in their legs can present with leg pain. And just simple aches and pains of being an active person can cause leg pain at times.
All right. Thank you so much for coming in. If you have any other questions or you'd like a referral, you can call 1-800-MD-MERCY.